All right, great job on the manual muscle quiz. The case studies were a little bit of the harder questions, which they should be. They should be harder questions. Got to figure them out. So everybody did great. Average was 91%. Um, we'll look at a lot of the questions everybody got, so I'm not even going to look at those. Obviously, the patient's height is not going to affect strength and limit objectivity in manual muscle testing, but their gender, age and gender could, and their muscle size could, and their fatigue and effort. So if your patient is tired, they might get different results, or if they're just not putting in the effort, they might get different results. Or little muscle, big muscle, little person, big person, you know, that stuff. Contraindication of performing manual muscle testing is acute inflammation and pain. Again, that's probably going to affect your results. Previous physical therapy treatment isn't going to have any effect. And um, patient age over 65, you still have to test their strength, even if they're over 65. And there's research that supports that you can build strength into your 90s. So no time to stop strengthening if you're over 65. That's the time to bust out those weights. So, uncontrolled hypertension is the precaution for manual muscle testing. The Valsalva maneuver increases intrathoracic pressure. If you already have high blood pressure, that's an ugly thing. Most people got that. Most people got that we use the break test method in this course. There are obviously other methods for testing manual muscle testing, which may be more objective. However, you always have your hands with you, and you don't always have one of those other tools. Functional testing is also really good. I really like functional testing, but in this course, we're focusing on manual muscle testing, the break test method. Um, for patient positioning, the part to be tested should be against gravity. So our first test is that screen test where we go through the motion against gravity. And if you can do the full motion against gravity, you get a 3. 3 out of 5. Everybody got that. Most people got that. Resistance should be applied directly opposite the line of pull of the muscles being tested. And using a short lever arm, that's going to depend on that was the only the people that missed this one put the short lever arm. If you're trying to eliminate a two joint muscle from the testing, you might use a short lever arm, but in general, resistance is applied directly opposite the line of pull of the muscles being tested. This was the hardest question. A manual muscle test grade given when a patient can move through the full range against gravity and hold the test position against gravity. So full range of gravity and hold the test position, which means like shoulder flexion, you can hold shoulder flexion, and it is a grade 3. Grade 5 normal is not full against gravity and hold the position against gravity. It's a full range against gravity, and you can hold the test against strong pressure. That is grade 5 normal. So holding the test position against gravity, that's grade 3. So let's review that in lab. We'll review all the grades again before we do our skills check and make sure that everybody's 100% clear on that. A grade of 2, poor, is given when the patient can move through complete range of motion in a gravity eliminated plane. Most people got that. Slight contraction but no visible movement, that is 1 out of 5, or trace. Strength. These were all most people got those. A few people mixed up one or two of them, but um, core is um, core is 2 out of 5. Good is 4 out of 5. Fair is 3 out of 5. Normal is 5 out of 5, and trace is 1 out of 5. Okay. Slight movement but no visible contraction. That's a grade 1. That's a trace. Grade 0 means nothing. No visible movement, no twitching of the tendon, no slight movement, nothing. 0, 0, 0. 0 all the way around. Grade of 4, you can hold against moderate pressure, but it does break in the end. Hold against strong pressure is grade 5, and it doesn't break. Hold against slight pressure, probably a 3+. That's where you got to drag out your pluses. What's the most objective, repeatable, and reliable observation made during manual muscle testing? This was in the lecture. Grade 3, fair, because it's against gravity, and gravity's the same. I don't know, it might be different if you go from the North Pole versus the equator, but it's pretty much the same. And I don't think we're going to go to that level of testing. So grade 3 is the most objective, repeatable, and reliable observation. Not grade 5 because the resistance that you put versus the resistance that I put might be a little bit different. Same thing with grade 4. Okay. The 3+ means hold the test position against slight pressure in addition to gravity. And where this is important, remember how we said the pluses and minuses are used when it's functionally important? It could be functionally important if the person has to wear an orthosis or something that's going to provide just a little bit more weight than gravity, a little bit more pressure than gravity. But if they just have anti-gravity and can't hold even the slightest pressure, they're not going to be able to wear that orthosis either. So that's why it's functionally important. And holding a position against moderate pressure in addition to gravity is a grade 4. So plus or minus grades should be used, and everybody got this when they provide important functional information, like I just talked about. The screen test, if they can only move through a partial range of motion against gravity, then you should place them in a gravity eliminated position. So in screening, we're screening whether it's a 3 or above or below a 3. And if they can't hold the position against gravity, then it's not a 3. And they have to go gravity eliminated. And I think some people were still a little bit confused on reporting gravity eliminated and gravity and everything. You're never going to report both in your SOAP note. Because if you have to put them into a gravity eliminated, then they're automatically not a 3, 4, or 5. When we did our demonstrations in the lab, we demonstrated both just because we were doing demonstrations, but you're never doing both on the same person. So either it's gravity eliminated and it's 0, 1, or 2, or it's with gravity and it's 3, 4, or 5 with the pluses and minuses. So hopefully that makes sense. If it doesn't, ask me. So everybody got the brake test. Everybody got palpating the muscle belly. Proper hand position using the lumbrical grip. That's so we don't dig our fingers into people, and we're not just going to use palm pressure because we want to be able to control the limb. So lumbrical grip is the answer. Multi-articular muscles need to be tested in mid-range to avoid positions of active insufficiency. There you go. Most people got that, but that's true. They're not, multi-articular muscles are not stronger than monoarticular muscles necessarily. Like 1-to-1, against a smaller muscle, they might be stronger, but that's not the answer. And it is easier to manage the longer limb segments in mid-range, but that's not the reason we test in mid-range. It's to avoid positions of active insufficiency, which can affect the strength of the muscle being tested. This was one of the harder ones. What should you check in the patient's position for while performing manual muscle testing? And we are checking for substitution movements. We're not checking for pain level in their positioning. We're not checking for joint range of motion. That's a separate measurement. We're not checking for joint stability. Nobody picked that, but we are checking for substitution movements to make sure that we are really testing the muscle we think we're testing. Everybody got that one. Most people got that one. Test both sides to provide comparison, especially when one side is more affected, which is, most of the time. And also we're providing comparison so we know what's normal for that person. Like they just might be generally weak and their unaffected side is weak, or weaker, and their affected side is even weaker. So we're testing both sides to kind of see what's normal for them. What are we shooting for? They might not get to what's normal for somebody else, but it doesn't matter. We want back to what's normal for them. Clinical limitation of manual muscle testing, most people got it. The results don't indicate the ability to perform functional movements. And it shouldn't take too long to perform it. It only takes a second or, a minute maybe. So the results, just because you can pass a manual muscle test or just because you could get a certain score on a manual muscle test doesn't mean that you can actually do a functional activity. So we did some of that functional activity testing in lab, and that tells you whether or not you can do a functional activity. So Amy, she fell, she injured her shoulder, 4 out of 10 pain, difficulty lifting arm overhead. We see that she can lift her right arm to shoulder height against gravity, but can't hold the position when you apply even slight downward pressure. So that's not full range of motion against gravity. So we put her in a gravity eliminated position, and now she can do the full range of motion and can hold moderate resistance in this position. So she has like fairly good strength. We have a good muscle contraction in the deltoid and no substitution patterns, but she can't, but gravity is her limitation. So based on her performance against gravity, we're going to do a 3 minus because she can do a little more than 2. You could say 2 plus. That's not one of the choices. She can do a little more than 2. So 2 would just be she can move through the full range of motion in a gravity eliminated position, but she can hold a little bit of resistance. So she's almost a 3. Gravity is her big. That was a hard question, and as you can see from the results, it was a hard question, but it should be a hard question. Everybody got her ability to hold against moderate resistance in the gravity eliminated position suggests that she has adequate muscle activation, but weakness against gravity. So everybody got that. And the most appropriate next step in Amy's assessment would be to document that grade 3 minus or 2 plus, if you like, and note pain as the limiting factor. Because that was her limiting factor according to the case study. So we're not going to proceed to test other muscle groups necessarily. I mean, we might if it's indicated. We're not going to document grade 3 because she doesn't have grade 3. She doesn't have full anti-gravity range of motion. And we are probably not going to retest in 1 week either. And it's not the next step. That's like a week later. It's not the next step. So the next step is to document it and note pain as the limiting factor. So the case studies were hard. They're supposed to be hard, but kudos for doing a good job and great job on your reflections. People had some really excellent reflections on how they did in the lab, and I appreciate the time that you took to do that. So if you have any questions, you know where to find me. And we only have a few things left for this quarter. We just have the skills checks in lab on next Monday. We have the myotome dance, little 5-point myotome dance. We have the final test, which will be open all that week, and the physio U modules for posture. So that's it. That's all we have left, and that one lab day. So it's pretty exciting. We're almost done.